Hi friends, Dr. Sarah this side. Today I thought we'll do something different and we'll learn how to calculate EDD, right? So that is the expected date of delivery. So this will be useful for students and for obstetricians working or also for the patient herself if she's curious to calculate her EDD on her own. And besides that, we'll also learn about period of gestation. That is to know like if today, supposing 15th of April, what is the period of gestation, how far along you have come in your pregnancy. So to know that, we need to calculate something that is called as POG. Okay, so we'll understand how to calculate this and how to go about it. So basically, we'll understand this under the headings of if it is regular cycles, if you have irregular cycles, and if you do not have any idea of your LMP at all, not known. Okay. Okay. So first scenario, that is regular. Okay. So we calculate the EDD from LMP. Now, this is very important to know. So, what is LMP? LMP is last menstrual period. So, it is very important to know the last time you had your periods before you were pregnant. Okay. So, from there on, we can calculate the expected date of delivery. Why so? Because uh, generally, pregnancies in human last for 280 days. That is approximately 40 weeks. Not approximately, exactly, sorry. 40 weeks. So why 40 weeks? In the terms of obstetrics, we call a baby term when it is between 37 to 42 weeks, right? So what is term? Term is basically a baby who's fully developed, who's ready to come out and who can survive outside on its own. So that is that is term baby coming with these days with the new technologies that are coming in better NICU facilities, babies before this also can survive with some assistance. But 37 to 42 weeks is the term baby. Okay. So anytime you're delivering a baby between these weeks, it's safe to say if the baby will be healthy if everything else is good. Okay. So that is 37 to 42 weeks. A baby delivering before 37 weeks is a preterm baby, and more than 42 weeks is postterm. Now, over here, it is very important to know if supposing a doctor has given you after calculating the EDDs, supposing at certain dates, like 14th May, okay, and supposing you do not deliver by 14th May, so you should not panic. You still have a period of 2 weeks approximately before you call it post term. So the baby will be post dated, yes, post dated, but not post-term. So a baby delivering between 37 to 42 weeks is fairly a healthy baby. Okay, so you don't need to panic if the expected date of delivery crosses by a week or so. But you still need to go and see an obstetrician, of course. But I'm just saying only 5% of babies deliver on the expected date of delivery. You can have your miracle before that or after that. It is very much okay. So you just need to be in touch with your obstetrician, and in case it goes beyond EDT, do not panic. And that is all that I wanted to emphasize over here. So only 5% of babies deliver on EDT. Okay, so coming to the topic at on hand. Okay, so supposing your LMP is 1st of July last year. So how do you calculate? So basically you will add 7 days first and then you will add 9 months to the same date, right? So if you add 7 days and 9 months, okay, so it will be your EDG of the patient will be 8th of April 2023, right? Okay. Now supposing I give you the LMP as 30th of July 2022. Okay. So remember, first add the 7 days. If you add the 7 days, you will get the date of 6th of 8th, 2022. And in this, you will add the 9 months. Okay. So now if you add the 9 months, it will be 6th of May 2020. So I often see students making this mistake that they just simply add 7 here, 9 here. That is fine, but what if the months are changing? Okay. So it will be, and besides it's common sense also. So it will be 6th of May 2023. Okay, there is another thing that student must have come across. It's called Negley's rule or Negley's formula. And it is important to know theoretically if you're going for an exam. What happens is Negley said that to the LMP add 7 days and subtract 3 months. So that will give you the EDD, right? So that is Negley's formula. So far, whatever I've told you, it is easy to calculate the EDD if you are having regular cycles. So regular cycles is when you have cycles of approximately 28 days. Okay, that is how you calculate the EDD. Now, supposing if you have irregular cycles. So supposing if you have irregular cycles, then how to calculate the EDD? If the patient says that her cycles are not regular, and by that I mean that there is a discrepancy of more than 10 days or more than that. So it is before 10 days or more than 10 days of our expected date of menses that was supposed to come, and it happens on a regular basis. Then what you're supposed to do is first ask her LMP, okay, and calculate her EDD as above 7 days plus 9 months. And to that, you either subtract or add the number of days that are more or less than the usual. That is, if supposing her cycles are of, let's say, 18 days instead of 28 days, so whatever EDD you are getting, you have to subtract 10 days if she has shorter cycles. And if supposing she has 38 days cycle, then you're supposed to add 10 days. So whatever EDD you calculated, add 10 days. So how to go about it? First, ask her LMP, the last LMP that she can remember. Calculate EDD from that LMP as we discussed above, 7 days plus 9 months, and then you can add or subtract the number of days which are more than the 28 days cycle, right? So that is how you calculate for irregular cycles. And last but not least, unfortunately, we also have patients like these who do not know their LMP. That is, LMP is not known. Okay. So either you can jog their memory by asking them the LMP around festivals that we do generally, like if any important festival was around, or you can remember your LMP accordingly. Either we can do that, or you can ask for her to undergo an ultrasound. Now, this is a gold standard for anyone. Like even if you're able to calculate EDD for someone who has regular cycles, you obviously will ask her to go for an ultrasound no matter what, because that is a very important tool we have now, which is gold standard to diagnose the EDD. Now, as far as ultrasound, how many ultrasounds to be done and for dating when, which week you are supposed to do it for the most accurate one, what is the accuracy rate? I can have another video for that if you're interested. Do write a comment below and let me know if you're interested in that. Okay, so that was about EDD. Now coming to the next topic, POG. How to calculate period of gestation. Now that is another important thing that you're supposed to know in the basics of obstetrics. Supposing the ED, or sorry, the LMP, not the EDD, the LMP is supposing 15th January 2023. Okay, and the date today is 15th April 2023, right? So from 15th April to 15th January to 15th April, how many days are there? First of all, you have to calculate that like this. I'll tell you two methods. Okay. First, jot it down. Okay. So from January to February, it is 4 weeks. You have 4 weeks plus 3 days. So every cycle is calculated as 28 days. So January, we all know this, has 31 days, right? So it is 28 days plus 3 days, right? And for some a month like April, when you have only 30 days, it will be 28 plus 2. So that will be like 4 weeks and 2 days. You getting my point? So 4 plus 3. But for February, you have to know if it's a leap year or not. So for February, it is 4 weeks only. Okay. And then it is, this is from February to March, and then again, March has 31 days for 4 weeks plus 3 days. Okay, so you calculate the 4 weeks, that is 12 weeks plus 6 days. Okay, okay. Another method is that you simply calculate the number of days between the LMP and the day that you're calculating it. So this is coming out to be 90 days, and you divide it by 7, right? Because that is the number of days in a week. So if you do this, you will get it as 12 weeks plus 6 will be your remainder, so 6 days. That is how you calculate the POG for this person. So I hope it clarifies it and you're able to calculate your POGs using this formula. And I'll give you another exercise. Supposing this person comes on LMP is 12th January 2023. So what will be her POG as of today, right? So again, we'll do as before. Today is 15th of April, right? So we'll do what we had done before, and 12 1, 12 2, 12 3, 12 4, and 12, okay, 12 4 plus 3 days more because it is 15th today. So 4 plus, so 12 weeks plus 6 days plus 3. So we know there's nothing like 9 days. So it will be 13 plus 2. That will be her POG as of today. Right? So I hope these simple exercises will help you to calculate the POG and the EDD of the person, of the patient that comes. Besides that, of course, there's always apps nowadays. You can simply put down the LMP and get the POG and the EDD both. That is great. We are living in the times of technology, but it is a very basic thing to know, and you cannot forego this if you are a student or an obstetrician. So you must know this. And for the patients themselves, if you are finding it tedious, you can simply download an app. There are plenty of there available, and you can calculate your EDD or POG according to that. So I hope this helps. And if you have any queries, do write it down. And hope you have a great day. Bye bye.